Another sign there is an end in sight to the COVID pandemic. The CDC issuing new guidelines that now more than 30 million people have been vaccinated. The new rules bring us one step closer to normalcy. So let's look at it. The CDC says fully vaccinated people can visit indoors with others who have been vaccinated without mask or social distancing. They can also visit with unvaccinated people as long as they are low risk. They no longer need to quarantine or test if they don't have any symptoms of COVID-19. So let's break this down. Let's bring in Dr. Shereef Elnahal, the CEO of University Hospital in Newark, to join us this morning to explain what these guidelines mean. Good morning. Always good to see you.
Good morning.
So
Thank you
CDC
so much.
absolutely is relaxing these guidelines, even though 90% of the population still has not been vaccinated. So is there no longer a concern of spikes? Are you a little concerned about the relaxation of these guidelines?
Well, first of all, let me say that we do have three excellent vaccines, and we just got the Johnson & Johnson vaccine here at University Hospital, so we're using all three. And one thing I want to emphasize is that these are excellent vaccines. And so the CDC's move yesterday makes sense because it is measured. It is an incremental step. It is not completely turning off the switch and saying, okay, you don't have to socially distance at all. You can go out into large gatherings. You can only visit folks at home who are completely vaccinated without masks and social distancing. And grandparents can visit grandkids and younger family members if they are low risk, and they don't have to be vaccinated in terms of the family members. So again, these are measured steps. Of course, there is still a risk of another spike. We have the prospect of variants, unfortunately, that may be more easily spread. But the fact is, this isn't completely turning off the switch of being careful.
Right. Well, I want to get to that second part because I think that's where some of the questions come in, that if you're vaccinated, you can visit folks who are not vaccinated if they are low risk. Help us determine that. I know you mentioned kids, but a lot of people may not have the virus or may have the virus and not even know it, right? So are you creating a possible problem here?
Well, because the vaccines are so good, the CDC basically determined that even if somebody who's low risk but carrying an asymptomatic infection is low likelihood to spread that disease to an older person who is vaccinated. And so that's where that reason comes from for that new guideline. But overall, again, I think it's important to understand that we have more and more evidence that these vaccines not only prevent severe disease, hospitalization, and death, but also have a low risk of you spreading it to others if you are vaccinated, which is why, again, the CDC wants to encourage us to get vaccinated. And one great thing that's going to come out of this is that folks may be more encouraged because they have these new latitudes.
Right. Well, and you talked about the new Johnson & Johnson vaccine, which I think is very important. It's going to be, a really game changer for a lot of folks who just want one shot. But a lot of folks are also worried about the efficacy of it, right? It's only, 65% when it comes to some of the mild symptoms. So that being the case, can they spread it perhaps a little bit easier, or are they fully protected from spreading it?
I'm glad you asked about that, because I think the most important end game to understand with vaccination is to prevent hospitalization and death. And so all three vaccines have 100% effectiveness at doing that. So I just want to keep emphasizing that to folks who may think there's a meaningful difference between Johnson & Johnson and some of the other vaccines. That's really not the case when it comes to the most important outcome. Sure, there is a low risk of contracting the disease and spreading it if you are vaccinated, but we've really seen very few, if any, of those examples in most places throughout the world, and certainly in this country. And so again, because folks are eager to get back to normal, to have a little bit more latitude, I do think it's a responsible decision.
Gotcha. So how long do people have to wait after getting their vaccines before they start gathering indoors without those masks on?
We get that question a lot. It's really important to understand this. So you're not completely immunized right when you get the shot. And if it's the Johnson & Johnson shot, it's only one time. But if it's the other two, it's two shots. So it takes a little bit longer to get immunized with Moderna or Pfizer. You want to wait at least 2 weeks before your last shot, whatever vaccine you take, before you sort of assume that you're vaccinated. And really a month is when you're absolutely sure based on the data. So remember that it's not a one-shot deal and you're immediately immunized.
Right.
When you get these shots.
All right. Well, it's good to know, especially when folks are ready to get back to some kind of normalcy. Doctor, as always, we appreciate your insight. Always good information. Thanks for joining us.
Thank you again.